So what if I tell you that when you have typhoid fever, it means you've ingested the feces of an infected person? Hello guys, my name is Chico Budneswise, and today we'll be discussing typhoid fever. Remember in our last podcast, we talked about malaria fever, we looked at the mode of transmission, we looked at the causative organism, the signs and symptoms, treatment, and even complications. So today we'll be discussing on typhoid fever. Please take note that this is strictly for educational purpose and not for any form of treatment or diagnosis. This is brought to you by Stethoscope and Sacrifice. So typhoid fever is a life-threatening illness caused by a bacteria called the Salmonella typhi. How is this bacteria transmitted? It is transmitted through the fecal-oral routes. It means you've ingested the feces of an infected person. Okay? And how is typhoid fever treated? Since we said it is caused by bacteria, it is basically treated with the use of antibiotics. Okay? Basically, antibiotics will take care of the bacteria that causes typhoid fever. What are the symptoms of typhoid fever? Usually, it starts with high fever within 103 to 104 degrees Fahrenheit. Okay, from high fever, you have malaise, we have headache, we have anorexia nervosa. Anorexia is simply loss of appetite, and then later you begin to have abdominal pain and fatigue, chronic fatigue, and so on and so forth. Okay, and so what are the complications if typhoid is not properly taken care of? Because the symptoms manifest in stages. Okay, most times typhoid fever can last within months or even more, but if not taken care of on time, there are terrible complications that such as perforated intestines, because these bacteria will begin to feast on the intestines and they end up perforating them. Okay, and the only solution to that is through surgical intervention. Okay, and you can see that it will lead to increased cost of treatment, prolonged hospital stay, and more terrible complications. So it is important that we take our hygiene very personal. Okay, so these are preventions of typhoid fever: good personal hygiene, proper hand washing. It is important that you wash your hand properly under running water with antiseptic soap, especially after using the restroom. Okay, you please avoid eating raw vegetables. If you must eat raw vegetables, then they must be properly washed. Okay, just to make it safe for consumption. And then you please ensure good environmental hygiene as well. Your restrooms, sometimes some of us just leave our restrooms dirty and they don't even take care of them. It is important that you keep your restroom clean. After using the restroom, you please make sure you properly tidy up that area before even leaving, so that when the next person comes, he does his own basic cleaning before using the restroom. That way, we're all safe and typhoid fever would not continue spreading. Thank you. This is just to let us know about typhoid, and I'll see you guys next time.